Okay, good morning to all. We were discussing about clinical approach to vomiting. In the last class, we have seen 2 or 3 cases related to childhood vomiting, and today we will have the continuation of the same. So we will today discuss about case number 4, which is related to vomiting. Okay, so carefully read this case. This is an 8-month-old infant presented with vomiting. Infant is 8-month-old, okay, and it is presented with vomiting since the last 2 months. Child is having vomiting since the last 2 months. Now, naturally, we have to inquire which type of vomiting, what is this. And what mother says is he was absolutely fine till 6 months. 6 months of age, there is no problem. Usually, up to 6 months, we will go for exclusive breastfeeding, and therefore he is absolutely fine. But after 6 months, since last 2 months, the child has got the problem. What is the problem? Problem is vomiting. And when you inquire more further, there is no other symptoms. There is no any other symptoms. Now, according to mother, growth of the child is good till 6 months. So mother says till 6 months of age, he is gaining the weight normally, and he is absolutely fine and doing well, alert, active, everything. Now, this last 2 months, he has got the problem of this vomiting. And she is also telling that since last 2 months, weight is not increasing. Up to 6 months, the weight was normally increasing. Okay, he gained almost 4 kg in the first 6 months. But afterwards, there is no much weight gain and he is falling down. Now, according to this history, nothing is available here, isn't it? Only thing is available is child is having vomiting. He is fine up to 6 months. And there is no weight gain after 6 months since last 2 months. See, in such cases, we have to poke some more information from the mother. So you just ask some of the personal history about the appetite and all those things. So now when you ask some of the personal history, so mother is telling that he has got severe anorexia now. Presently, severe anorexia, that means he is not willing to take anything. Severe anorexia is there. And mother is also telling that he is passing plenty of the urine. He is also passing plenty of the urine. See, all these informations are from the personal history. So when no clues are available, we have to start asking more on personal history. Okay, passing plenty of the urine. Then mother is also telling that since last 2 months, he is also little irritable. And since last 2 months, he is also constipated. So what is the reason why for the constipation that mother is giving? He is not taking anything, therefore he is constipated. So now we have got 2 or 3 more symptoms. Number 1 is he has got severe loss of appetite, anorexia. Then he is also passing plenty of urine, okay, according to mother. And then he is also having some irritability, and he is also constipated. Okay. Now then we have gone for all the routine tests. All the routine tests were done, and all the routine tests were like related to GIT, related to liver, related to CNS, and even related to renal. Okay. So all these tests were done to find out some of the one or the other cause, but everything is normal. Only some of the constitutional symptoms are present, like anorexia is there, okay, or passing excess urine is there. Now again, passing excess urine, mother may say that he is drinking also more, therefore he is maybe passing urine more. In such condition, you have to ask the history how many times at the night hours he passes. Okay, now 8-month-old baby means he passes urine in the night month also involuntarily. Now you have to ask about this particular history. Okay, anyway, so all the other investigations were normal. Then on direct questioning, yes, personal history we got, that is constipation is there, polyuria is there, that is excess urine is passed. We are not sure whether it's a polyuria or something like that. Irritability is there, and loss of appetite or anorexia is there. This is a history which have got. Now we have to identify what is the cause of the vomiting. The main complaint of the mother is vomiting. He is vomiting more. Okay, he is more vomiting. That's in the last 2 months he has got the vomiting. Now we will go further. Now this baby is normal till 6 months. That's very important. According to mother, everything is fine up to 6 months, and after 6 months onwards, the problem started. So then he started with the vomiting, and growth is very good till 6 months of age. Okay. Now, first thing which comes to our mind is there may be some problem related to the feeding problems. Okay, like after 6 months, usually we will go for some supplementary feeding, And most of the time we think that whether mother is going for some forceful feeding or monotonous type of feeding, so therefore child is rejecting the food, not having appetite, etc. So these are the first thing which comes strike to our mind. Okay, so maybe the feeding problem, because all the problems started after 6 months. But there is more passing of the urine is there, irritability is there. When the child is irritable, most of the time it is not a simple cause. There will be some cause definitely. So loss of appetite, irritability is there, polyuria is there, constipation is also there. So now we have to think further. It may not be a feeding problem. This looks like an acquired disorder, but not congenital. Definitely there is some disorder is there, maybe acquired. It is not congenital, because if it would have been congenital disorders, the problem should have been from the birth itself. Okay, now 6 months, up to 6 months child is absolutely fine, no problem. And only after 6 months the problem started. So definitely it is not a congenital problem. And it even not looks like a feeding problem. But some problem is there. Some acquired problem is there. That's what we have to find out. Now, when we don't get any clue, ask the personal history as I told. So what is she is telling is, mother is telling is severe anorexia, passing plenty of the urine. And there is also irritability since the last 2 months. And is also constipated. Let us see further. Now, a lot of urine is formed in spite of repeated vomiting and fluid loss. This is quite interesting if you see in this case. Child is having vomiting. A lot of fluid has been passed there, isn't it? So some of the fluid has been lost through the vomiting also. In spite of that, although the fluid has been lost through the vomiting, in spite of that, child is passing more amount of the urine. Okay, this is quite significant, isn't it? Then from where actually this fluid comes? Through the vomiting also fluid lost. Okay, and through the urine also fluid is lost. So one thing is very clear, something related to kidney is there. Something related to kidney is definitely present. Now, if you look into anatomy of the vomiting. So as I told, vomiting, we have got vomiting center and chemoreceptor trigger zone. Okay, so these are the two important vomiting centers which are present in the brain. Okay, now if you see chemoreceptor trigger zone, most of the time increased intracranial pressure, so that leads to stimulation of the chemoreceptor trigger zone or some chemicals or metabolites, etc. that may lead to vomiting. Now here there is no problem in the GIT, there is no problem anywhere. So this ICT is increased intracranial pressure. So this particular condition has been excluded anyhow. Even the GIT, there is vomiting is there, but no other problems. Now, the remaining is only one, that is the metabolic. Remaining the problem is only one, metabolic. Now, there may be some metabolic problem. Because of that metabolic problem, some toxic unwanted metabolites are formed. These metabolites are entering into the blood, and through the blood they are going to the brain and affecting the temperature regulatory system area, vomiting center area, like chemoreceptor trigger zone, and doing some irritation there, and because of which a child is vomiting. So this possibility is there. Now we have to understand, go for investigations. Which investigation you want to do? Now child is also passing more amount of urine, child is also having vomiting, none of the other symptoms are there, growth failure is there. Okay, growth failure is started. So now first thing you have to exclude is some of the diabetes 1 like conditions maybe. So therefore you go for ketone bodies, because these ketone bodies usually causes vomiting. Okay, ketone bodies, so they are acidic substances, and they therefore ketoacidosis occur, and it will affect the chemoreceptor trigger zone, and it can mediate the vomiting. Okay, now go for two important investigation, that is ketone bodies and as well as ammonia. Okay, so now this investigation, when it is done, then it looks that it is found that it is increased. Ketone bodies and the ammonia both are get increased. So now one thing is very clear, ketone bodies and ammonia, where ammonia is handled where? Actually handled in the liver, but it is excreted through the kidney. Now kidney is not able to excrete the ammonia properly, or byproducts of ammonia properly, and as a result ammonia is increasing in the blood, and that ammonia is causing the irritation to the vomiting center, and as a result child is having vomiting. Now this is some case which is related to renal tubular disorder. Okay, so renal tubular disorders. Now see, what first you will get in your mind is this may be a case of diabetes mellitus, isn't it? But it is not diabetes mellitus. The reason is you have to look into the glucose also. All the routine investigations are showing normal, but still child is having excess passing of the urine. Now here, this is a case of renal tubular disorder. That means renal system is not able to handle this ammonia, urea and uric acid, and as a result ammonia byproducts remain in the blood, and that is causing the vomiting. That is because of some of the renal tubular problem. Okay, so now this is a case of renal tubular disorder causing the metabolic derangement, and then as a result there will be vomiting. Okay, so because all the investigations are routine investigations, what all we have done, that is normal. But when we go for ketone bodies and ammonia, it is increased. That suggests that ammonia is not properly handled, and as a result this is a problem. Okay, so this is a case number 4. So sometimes you also get cases like this. Okay, now which type of renal tubular problem it is, so that's a different issue. We have to find out by further investigation. So this is about case number 4 related to approach of vomiting. So such type of cases will be also there.